why is the Africa's population such an attractive target to big tobacco industries?
It's projected that many African economies will do well, and as such, more young people would have more disposable income to purchase tobacco products.
I'd like to ask, what do you mean by corporate social responsibility when it comes to tobacco firms?
So you find out that they are involved in something like tree planting.
Oh.
Yes. So they sponsor most of these things. I think one time in Nigeria, I heard that they went to NYC camps.
You're welcome to the CSEA Podcast. On this episode of the podcast, we talk about how the tobacco industry is increasingly targeting Africa's youthful population and the effect this strategy has on the continent's development. We are joined by Mrs. Priscilla Airohi, a research associate here at CSEA and a research analyst and project manager on the Tobacco Control Data Initiative project. You're welcome to the podcast, Mrs. Priscilla.
Thank you.
Yeah. So we'll be diving today into youth data and the tobacco crisis in Nigeria. So the first question I wanted to ask you is, does Nigeria have any policies in relation to tobacco control? Because I feel like this question will put perspective on the other questions we'll have. So what efforts has Nigeria made to make policies targeting excessive advertisement, especially on the underaged in Nigeria?
Okay, yeah, thank you for that question.
Yeah.
Tobacco policies dates back to 1990 in Nigeria with the emergence of the Tobacco Smoking Control Decree. But then when Nigeria transitioned from military rule to civilian rule, that decree was changed to an act, so it became the Tobacco Smoking Control Act. And then in 2004, Nigeria signed the WHO FCTC and ratified it in 20th of October 2005. Currently, we have the National Tobacco Control Act, and one of its elements is that they prohibit the sales of cigarettes to people below 18, and also there's also a prohibition of advertisement of tobacco products across digital platforms.
So these digital platforms are like social media, including Instagram, LinkedIn, or just TV and
more around TV.
Oh,
yeah.
So they get like almost like a leeway or a gray area around social media.
Yes, they do.
Okay, that's great. So why is the Africa's population such an attractive target to big tobacco industries?
Okay, thank you for that. First of all, the tobacco industry see children and youths as replacement smokers, and for that they are critical to their critical markets for their tobacco products. And then in Africa, if you look at it, the African population is projected to double by 2050, so we should have around 830 million people on the continent. So that indicates that there's going to be a large market size for tobacco products. Then secondly, it's projected that many African economies will do well, and as such, more young people would have more disposable income to purchase tobacco products. Then thirdly, around some African countries, you find out that their tobacco laws are still very weak, still in their nascent phase, and then the industry can ride on those loopholes to get to the youths and children.
Right. So this even fits to what I was saying before as to how these tobacco companies get almost like a gray area when it comes to social media. So the next question I was going to ask you is, what are the tactics that big tobacco companies have taken to bring advertisement forward, even after they have been banned from advertising these products on, TV platforms and all?
Okay, so one of the things they do across many African countries is strategic placements. So what they do is to place tobacco products alongside sugary drinks, snacks, or even sweets.
So you mean strategic placements in terms of how these products are placed in the stores?
Yes, exactly.
Okay.
Exactly, that's what they do. Secondly, they use brand influencers, people on Instagram, people on Facebook, most recently even TikTok. So you find out that our generation now, the people say we are in the TikTok generation. So you find out that they use a lot of these influencers to gain people to use their products. Then thirdly is that they sponsor events, music festivals, sports festival. So that's another way. They also do some corporate social responsibilities. And I think another thing...
Sorry, I'd like to ask, what do you mean by corporate social responsibility when it comes to tobacco firms?
So you find out that they are involved in something like tree planting.
Oh.
Yes. So they sponsor most of these things. I think one time in Nigeria, I heard that they went to NYC camps. Yeah,
that's
to do
very
something.
Strategic.
Yes, that's very strategic. And another thing they do, if I can remember, is that they make their products affordable by selling single-use cigarettes. It's prohibited, but they still do that. And they also make use of coupons to make their products free. They do giveaways. So when people see that these products are affordable, so it's more like an attracting thing for them. So they get to use tobacco. So that's one of the things the big brands do to still maintain their market size and their market share in the industry.
So in summary, it's placements and how affordable these products are.
Exactly.
So going back to the topic of policies, right? What other African country has made significant effort in establishing policies around tobacco control and, banning tobacco advertisements?
Okay, so a good number of countries in Africa have ratified WHO FCTC. So you have countries like Nigeria, for example, they are doing well. Countries like Ghana, countries like South Africa, even though it's still high, it's almost like a pandemic in South Africa, but their government is doing well. Places like Congo, Brazzaville, the DRC, Kenya, Ethiopia, I think they are really stepping up on their games to cut on what the tobacco industry is doing right now. So you see a good number of countries are doing well in that aspect, but that's not to say that there's still more work, because the tobacco industry is really targeting Africa, the African continent, because of, like I said earlier, its population growth, their large market size.
Share.
Most countries have weak enforcement system. Countries like, for example, Malawi. Tobacco is the mainstay of the Malawi economy. Yeah,
In what forms? Just cigarettes or?
No, tobacco farming.
Oh, the farming itself.
Yes. So many countries in Africa farm tobacco. In Nigeria, they do that. But people are beginning to gain exposure around the tactics they use. But then, like I told you, like countries like Malawi, they are heavily invested in tobacco farming. So as such, it's a good market for them. You find tobacco usage still high there. Countries like even, I think Uganda, they've done well. But like I said, the tobacco industry is still using strategies to gain entry into all of these markets through illicit trade, for example.
So when we come to the topic of tobacco harm reduction, which I understand is like encouraging people who are addicted to these goods to seek, reduced risk alternatives, like maybe e-cigarettes or smoke-free tobacco. So do you think this is truly a public health tool, or it's just a good scheme?
Okay, to start off with, the harm reduction concept is used by public health professionals to reduce the effects a drug has on its users. But then the tobacco industry is parading that concept to still maintain their market size and their market share. So you find out that, okay, as opposed to using traditional tobacco products, tobacco leaves, cigarettes, snuffs and all of that, they are saying, oh, you can use e-cigarettes, you can use vapes, you can use heated tobacco products. These are less harmful and these don't come at such a great cost. So they are parading all of these as harm reduction strategies, but then the effect is still bad. New tobacco products have nicotine in them. So you can't totally erode the fact that all of these products are dangerous to their users. The WHO still maintains that tobacco smoking kills around 8 million people globally every year. And 1.2 million people die out of secondhand smoking.
Secondhand smoking.
Yeah, so regardless of what new products they bring out in the market, they are still harmful.
Remain
the same.
Close to the same.
Yes, close to how they used to be.
Right. Okay, so in your view, what makes digital platforms so powerful? You explained that is it the fact that they reach out to a lot of people? So, and then they kind of can use, TikTok celebrities. Is that what makes digital platforms like social media truly powerful in advertising tobacco?
Yeah, you've just said that their reach is far greater. It transcends beyond Nigeria. It goes as far as like different African countries.
So even banning
different
them on
parts
TV
of the
has,
world.
Almost no effect because most of the youth are on TikTok.
Yes, most of the youths are on TikTok. And then you find out that around digital platforms, there's this thing called market segmentation. So, for example, if you want to run ads on Instagram or, say, Facebook, so there's something around demography, the age of people, what their income size. So you can really do that segmentation when you want to run your ads. So that makes digital platforms a really great tool for the tobacco industry. Then you've made mention of influencers. We are in the TikTok age, so the tobacco industry is making use of brand ambassadors, influencers to get their product out there
and in front of their consumers.
Yeah, so when an influencer comes on their page and be like, oh, smoking tobacco is likened to living a cool lifestyle. So then you have youths trying to imitate that, and they tell you that, well, like we say, these things are harmful. They're like, oh, I can be cool. It won't harm me, so I can as well use all of these things.
Right.
Yeah, so digital platforms are
really big on the effect they have.
Yeah.
So I want to go now into, youth use of tobacco and inequality. So to what extent does poverty and the existence of inequalities in Africa encourage youth to go into tobacco abuse?
Tobacco smoking and poverty are they are linked. Yeah, they are linked in the sense that most people who are poor see tobacco products as cheap alternatives for what's the word again I would use?
Stress relief?
Yeah, stress relief, psychological traumas and all of that. And then when people are poor, they don't have access to the information we have to tell them that, smoking tobacco is bad. They just see it as a form of relief to whatever they are feeling. And then in countries or in areas where poverty is very high, the enforcement of tobacco rules is minimal. So they are intertwined. You can't take them out. So the more people are poor, the greater the use of tobacco products.
Okay, so what data gaps exist when it comes to monitoring youth tobacco use, and what has been the work of the Tobacco Control Data Initiative project here at CC in filling this data gap?
Okay, so before now, we didn't have sort of a consolidated platform where you could access everything around tobacco. So you have them scattered around. So you find out that there are gaps even around the ages of children. Maybe the gender perspective of tobacco use. That's what TCDI aims to do. So what TCDI aims to do is sort of provide policymakers, civil society organizations, and even people in academia a sort of one-stop data shop for tobacco, for tobacco-related, would I say news, or what's the word? Information, rather.
Right.
So it's consolidated in the form that when you go to, and they are also country-specific. In TCDI, we currently have 6 countries. So when you go on the website, you find out that you can find out tobacco. You can find out about information around tobacco across, say, Nigeria, Kenya, Ethiopia, South Africa, DRC, So you find those kinds of information on our dashboard. In TCDI, we don't just bring out information like that on our dashboard. So one of the things we do is to conduct desk research. After conducting desk research, we interview stakeholders, like the different people in policy making, the policymakers, people in civil society organizations. We try to find out, okay, what do they need? We interview them in terms of their needs, like what do they want to see on the dashboard? And then we synthesize the findings.
Right.
When we synthesize the findings, we collect the data. After collecting the data, we now conduct what we call a validation workshop. So you have different stakeholders saying, oh, I need data on prevalence, I need data on shisha, I need data on illicit trade. So we sort of bring out all of these information out to them and we validate them. So when we validate them, we sort of determine the top data priority needs for them. So we have stakeholders who could say, oh, maybe do a voting sort of, and then they say, oh, okay, we need data on maybe youth prevalence of tobacco smoking. Want to know how it affects our country. Okay, we need data on the enforcement of tobacco laws. How big is it? How effective is it in curtailing the use of tobacco? We need data on, let's say, new and emerging tobacco products. Okay, what are the strategies the tobacco industry do? So when we have all of this information, then we go on our research, both primary research and secondary research. We collect data across all of these sources, and then when we do all of that research, we move on to the technical team. So they are the ones who develop the dashboard, put out the information that the researcher has done, and we put it out on the dashboard such that it's easy for stakeholders to navigate, for them to use for their policy making.
Right. That sounds like a lot of good work in this sector.
Yeah.
So the last question I'll now ask is for someone who may be watching and is interested in seeing the work that CC has or is doing on the Tobacco Data Initiative. Where can they go to find this dashboard that you mentioned?
Okay, so you can just go to TCDI.
The website?
Yes, there's a website, Tobacco Control Data Initiative.
Alright.
So you find it across the 6 African countries. We are currently working on adding a 7th country, but that's still work in progress. But then you can find data on Nigeria, South Africa. You can compare the findings and so that's where you can go to access all of this information.
Right. That's all the questions I have. Thank you so much for coming on the CC Podcast.
Thank you.
Yeah. Thank you for joining us on this episode of the CC Podcast. We hope you found this conversation as enlightening as we did. Don't forget to like, share, comment, and subscribe. See you next time.